Good morning, everyone. Today I'm going to talk about the topic how to insert the nasogastric tube. First of all, of course, we need to gather the relevant pieces of equipment and place into a tray. The first thing we need to get is, of course, the nasogastric tube, and then the disposable gloves, lubricant, and gauze to lubricate the tip of the nasogastric tube, and then a disposable bowl to be used in the event of vomiting for the patient. We need to prepare the paper towels to allow the patient to whip around their mouth if they need, and we need to prepare the last string to obtain an aspirate from the nasogastric tube. The pH testing strips is to assess the pH of the aspirate. Dressing is to secure the nasogastric tube, and a glass of water for the patient if swallow is deemed safe, and the last, the local anesthetic spray and to numb the oropharynx. Now, I'm going to explain how we insert the nasogastric tube. The first step, we need to lubricate the tip of the nasogastric tube. If available, a local anesthetic should be sprayed towards the back of the patient's throat. Then, we need to warm the patient you are about to insert the nasogastric tube. You need to get the consent from them, of course. And then, we insert the nasogastric tube through one of the patient's nostrils. Gently advance the nasogastric tube through the nasopharynx. This is often the most uncomfortable part for the patient. If resistance is met, rotating the nasogastric tube can aid in insertion. Avoid forcing the nasogastric tube if significant resistance is encountered. If the patient becomes distressed, pause to give them some time to recover. Intermittently inspect the patient's mouth to ensure the nasogastric tube isn't coiling within the oral cavity, and then continue the advance of the nasogastric tube down the esophagus. Ask the patient to take some sips of water and then swallow, as this can facilitate the advancement of the nasogastric tube. Avoid giving the patient a drink if their swallow is deemed unsafe due to the risk of aspiration. Once you reach the desired nasogastric tube insertion length, fix the nasogastric tube to the nose with a dressing. That is all the steps for insert the nasogastric tube. I hope you liked the videos today. Thanks for the attention.